officials urging people to recognize the early symptoms of pertussis, also known as whooping cough. They can take precautions and seek treatment. We've got Chief Medical Officer of diagnostics giant HealthTrackRx, Dr. Stephen Goldberg, with more, especially this season where we know that people are getting all kinds of sick. What should we be aware of, Doctor?
Well, we've got 25,000 cases so far this year, recent outbreaks in Texas, Iowa, and Kentucky. And in Kentucky, we've had infants die. Very, very sad. It's a cough, and then it gets worse, where you have rapid episodes of coughing that take all the air out of your lungs. And then it's followed by a deep whoop. And the whoop is because the airways are narrow and full of mucus. So that's what pertussis is. That's what whooping cough is.
And this is something that so concerns doctors that pregnant mothers get this shot, even if they've had the Tdap in prior years, which I believe is a 10-year vaccine. You still get it again once you're pregnant to help your child. And once the child is born, they again get some of this vaccine. But we're seeing the vaccine rates drop so much that there's been this incredible rise in cases.
You hit all the key notes. So first, immunization starts with pregnant women, and they have to get the vaccine every time they get pregnant. But only about 60% of folks get the vaccine. Then the next opportunity to prevent infection is young kids, and they need to get 5 vaccines before they enter kindergarten. But sadly, that rate is about 92%. We get good community immunity when we're at 95. So those are 2 key things we want to address as soon as possible.
Yeah, what do the symptoms look like? Because I think in this season, right, we all have a little bit of the congestion, the coughing. It not always is a critical virus, but still things that we should be looking out for.
You're right. It starts like every other cold, but then it starts to last longer and the cough gets more intense. So if you have a cough for about a week or 2, you should go get tested. And you can get answers very quickly as to whether you have pertussis or not. Then there's supportive care and also treatment. Treatment can likely shorten the duration, stop the spread, and those are things that I'd recommend.
All right. Any things that we need to talk to our doctors about as we head to the doctors here and maybe get some shots, or is it a little too late for that?
No, if you have any question as an adult about whether you're immunized, go get a single booster. It's tolerated really, really well. And if you have concerns, just talk to your clinician and get good information. You'll feel more comfortable. And if you see one child who's had it, you don't want to see a second.
Oh, absolutely not, especially for our little ones there. Dr. Goldberg, good to see you. Thank you.
You bet.